Hi, I'm Pauline Stolzner, a nurse practitioner here at Nevada Neurology and Vascular Center, and I'm going to discuss transcranial magnetic stimulation, also known as TMS, and its role in treating disorders such as chronic neuropathic pain, dystonia, headaches, Parkinson's disease, strokes, tinnitus, Alzheimer's, multiple sclerosis, migraines and headaches, traumatic brain injury, post-concussive syndrome, and depression. During this discussion, I will talk about what TMS is, what occurs during the treatment, prep, and side effects, who is not eligible for TMS, research studies, and insurance coverage. First, let's discuss what TMS actually is. TMS is a non-invasive method of brain stimulation that relies on electromagnetic induction using an insulated coil placed over the scalp. The coil generates brief magnetic pulses which pass painlessly and easily through the skull and into the brain. When the pulses are administered at a very fast rate, it can produce longer lasting changes in brain wave activity. Essentially, the electric coil transmits electrical activity into the brain and helps rewire the nerve pathways around the damaged area. So I'm sure you're curious as to what happens during a TMS procedure. So let me guide you through a treatment. During your first TMS session, several measurements are taken to ensure the TMS coil will be properly positioned over your head. Once this is done, the TMS coil is placed over your scalp. The machine will then be calibrated to your individual brain waves. Measuring the motor threshold helps us personalize the treatment settings and determine the amount of energy required to stimulate brain cells. Because TMS uses magnetic pulses, you'll be asked to remove any magnetic sensitive objects such as jewelry or credit cards. You will then be given earplugs for the treatment, as the TMS machine has a loud clicking sound with each pulse, much like an MRI machine. There will always be someone present to monitor you during the treatment, and you can stop a treatment at any time by asking the staff member present. As you relax in a reclining chair, each treatment lasts about 40 minutes. TMS treatments happen 4 days a week, and a typical course of TMS is 4 to 6 weeks. However, this can vary depending on a person's response to treatment. Now, I know you're wondering what kind of preparation you need for your TMS treatment, and the answer is none. Since the TMS does not require any sedation or general anesthesia, you will be fully awake and aware during the treatment. There is no recovery time, so you can drive home afterwards and return to your usual activities. What are the side effects, you may ask? TMS is a well-tolerated and associated with few side effects, and only a small percentage of patients discontinue treatments because of these. The most common side effect, which is reported in about 1/2 of patients treated with TMS, is a slight headache. These are mild and generally diminish over the course of the treatment. Over-the-counter pain medications, such as ibuprofen or Tylenol, can be used to treat these headaches. About 1/3 of patients may experience painful scalp sensations or facial twitching with TMS pulses. Again, these too tend to diminish over the course of the treatment, although adjustments can be made immediately in coil positioning and stimulation settings to reduce discomfort. The most serious risk of TMS is seizures. However, the risk of a seizure is exceedingly low, and we will follow up-to-date safety guidelines that are designed to minimize the risk of seizures. While TMS is a safe procedure, it is important to point out that because it is a new treatment, there will be unforeseeable risks that are not currently recognized. Unfortunately, the same patients who cannot get an MRI can also not get TMS. If you have any type of non-removable metal in your head, with the exception of braces or dental fillings, you cannot receive TMS. Failure to follow this rule could cause the object to heat up, move, or malfunction and result in serious injury or death. The absolute contraindications for receiving TMS is people who have aneurysm clips or coils, stents in the neck or brain, deep brain stimulators, electrodes to monitor brain activity, metallic implants in your ears and eyes, shrapnel or bullet fragments in or near the head, facial tattoos with metallic or magnetic sensitive ink, other metal devices or object implanted in or near the head. Now for the most important question I'm sure you have. What will this cost me? Increasingly, health insurers are recognizing the safety and efficacy of TMS as more clinical trials and other studies are published. Currently, insurance coverage for TMS therapy cost varies depending on individual carriers and plans and may be determined on a case-by-case basis. Here at Nevada Neurology and Vascular Center, we have a TMS coordinator who will work with each patient to help determine eligibility. Our TMS coordinator will answer any questions you may have regarding TMS therapy cost, payment options, insurance coverage, and reimbursement. Treatment with TMS does not promise miracles, but frequently changes quality of life. For instance, one randomized double-blind study conducted with TMS in aphasic stroke patients found clinically significant improvement of patients' speech when using TMS with other treatments. The control group did not show much improvement with speech therapy alone. Another single-blind study on TMS for the treatment of major depression found significant improvement and mood stabilization in patients treated with TMS with no reported side effects, as opposed to patients only treated with medications, showing little improvement with substantial side effects. For a more expanded list of studies, please visit our website. During this audio file, you should have learned what TMS is, what occurs during the treatment, prep and side effects, who is not eligible for TMS, research studies, and insurance coverage. This audio recording was made possible by the generous contribution of Nevada Neurology and Vascular Center. Nevada Neurology and Vascular Center is a comprehensive neurology practice dedicated to the diagnosis and treatment of neurologic disease. We are located in Carson City, Nevada. We encourage and welcome your input on this cutting-edge treatment. For questions, please give us a call and set up a consultation. Thank you for listening and have a great day.